This complaint is about how patients start to find out doctors out there, dental tourism, that it has been growing for more than 10 years, and patients start to look outside to do any procedure, not only dental. It's how they look, how can they find a solution to their health problems. Probably the governmental policies about health are not the best ones, or the support, but I think you need to start to find out why are patients going out. It's because also they can find a better treatment. They can find, they are not a number, they are more personalized treatment, a personalized procedure, a personalized way of developing a dental procedure. They start to go out, Americans and Canadians, from the States and Canada, like 10 years ago, to find and search for dental, for plastic surgery, for orthopedics, for even for cancer solutions, because FDA doesn't allow many procedures to be done in the States. So they go out to do it because it's their health, and they start to find out. And what do they find? They find that, just to understand that poor countries like Mexico, they don't develop nothing. They don't do nothing, not even a napkin. Everything's imported. Remember that Mexico imports everything. So everything on dental, it's imported. It's amazing how everything, the same materials we use here, they use it in the States, and they use it in Canada and in France and Germany. Because all those huge companies, that they have all the monopoly of materials, obviously they are the ones that have this big structure that they control everything. So what makes you think that if those patients are going to go out to find out from dental tourism, they're going to do a procedure in Mexico, what makes you think that the materials are going to be wrong? I don't know, it's only just because it's Mexico. You don't understand that this has been a policy of just putting Mexico really down, because we're hard workers in Mexico. I know that I don't look Mexican, because that's a more hereditary thing, but I have Mexico in my heart. And the materials we use here in Mexico are the same ones they use back home, same ones. I wish we could do Mexican products, but we don't have them. We don't have Mexican products. Everything's imported. So the same implants, the same porcelain, the same materials are the same ones they use back home. What makes you think that we're not going to use good materials? What makes you think that we're going to do it wrong? Probably we do more practice than many doctors in the States. Why can I say that? Because we have at least 5 years in dental school. And you know what? We open our doors in our universities, and we have tons of people that need to be arranged. So we practice a lot. We are used to work 6 days a week. We don't think about working 3 or 4 days a week. We're hard workers. Mexican dentists are hard workers. And yeah, there are some that they are lazy. Like in everything, you can find lawyers, you can find accountants, but there are so many dentists that they do it real good. What's the problem? That remember that we have 500 years that the Spanish came to invade Mexico. So we have been having 500 years of pushing us down. And right now, we have, with this global economics, we cannot produce nothing. There's nothing that the government tries to help the developers in Mexico. So that's why there's no dental products. It's not only that they don't want it to. You should think a little bit about more global economics. About dentists, they train themselves here and outside. Personally, I train myself a lot in the States and in Europe. And when I go to congresses, when I attend these congresses and see the speakers and the hands-on training and everything that needs to be done, they are not better than us. We do the same thing. Right now, this is like internet. If you go to Africa, you're going to have a worse internet than in the States. No, it's the same. Right now, it's a globalized thing. I think you should wonder why people are going out. It's because so many things. One of them could be budget, economics, the way that we treat them. Latins are used to treat patients really, really soft, but friendly, like family. That's what we try to do. That's what could make a little bit of difference of what we do. And that's what we show. We do it with passion, we do it with love. And also, we try to do the best we can. My complaint is to understand why patients are going out. It's more like, don't get angry because they go out. I think you should start thinking, why do they go out? Thank you.